Between a trigger point and a motor point, when I first got into that group on Facebook, nobody knew the difference between a motor point and a trigger point. The acupuncturists in that group, it was 2,000 acupuncturists in that group, and almost nobody knew the difference between a trigger point and a motor point. So I wanted to talk about it. A motor point is a good thing. It's an excitable part of the muscle. The muscle needs to be excitable so that the nerve can send that very low voltage signaling and make the muscle fibers contract. So we want motor points. Motor points are regions of the muscle that are hyperexcitable, easy to excite, and that's where we can put a needle, and even better, if you have some electric stimulation on the needle, you can get a multiple effect. If you don't have electric stimulation, you can still put a needle in the motor point and get a good result. You can still cause some release of shortened muscle fibers and thereby getting blood flow and a release of tension. But if you can use electric stimulation, and you can't use it on pregnant women, you can't use it on most people who have pacemakers. Some pacemakers now, the doctors will see if the manufacturer says it's okay. Sometimes they are now possible, but not on pregnancy, not on anyone doing chemotherapy, anything like that. You can't do it. I don't treat anyone who has uncontrolled blood sugar issues like type 2 diabetes, and where they're going to have gangrene or something. I don't treat anything like that. I won't do any acupuncture on anything like that. But electric stim for the most part is very safe. And just 30 seconds of electric stimulation at a low frequency on a needle in the motor point can have a big change in the muscle shortening. And that's what we'll be covering today. Trigger points are hyperexcitable taut bands that are often full of acetylcholine and pain chemicals. And if they become an active trigger point, they're actively painful. And they have pain referral patterns that have been documented over the decades. Dr. Janda Travell was an American doctor who did a lot of research on myofascial trigger points and pain referrals. And she learned, well, we'll go into that history. But trigger points are different because they restrict the mobility of the joint that the muscle is supposed to function. They actively create pain referral patterns, and they are constantly bombarding the spinal segment so that the spinal segment can then become hyperexcited and sensitized, causing a chronic pain syndrome that can be very difficult to treat if you don't know how to treat it, which is what we will cover. Yeah. Oh, am I out of this? I like it when you can't see me. So I started putting this slide in some of the very first lectures because someone had accused me of stealing their motor point locations. So I needed people to understand that no living human being discovered motor points or their locations. This guy figured out that we even have motor points by basically putting electric stimulation on fresh cadavers where he could get muscles to contract. Then he started doing it on his, his colleagues who would allow him to do it. So he discovered that our nervous system works on voltage. And then the doctors who were learning from him took an interest and started mapping all of those motor points. So you can find German motor point guides from the early 1900s. You can't create, you can't invent motor points. They are already there for anybody to use. So you can't own it, and you can't own their locations because they're varying on everybody. So the locations that we give are just guidance. I always call it guidance. Perotto's guidance. Aldo Perotto is who I follow for guidance because he was, well, probably still alive, but he published back in the 70s his like anatomical guide for electromyographers, which Georgina has like 3 copies left or something like that. But that's my guidance for motor points, for most motor points, because his guidance is very reproducible, and he gives lots of guidance on if you're too deep, you're in this muscle. If you're too shallow, you're in this muscle. And he gives really good guidance on that location, which I try to convey to you in all the slides and demonstrations and everything. But I want you to know that nobody invented motor points. They're already there. Dr. C-Chan Gunn, he didn't like acupuncturists very much, but he knew about acupuncture. He was Malaysian, and he moved to Canada and was working in pain management. And it occurred to him that many people had segmental issues that he could resolve with a needle by putting an acupuncture needle into the spinal segment area like the multifidus. He could treat their chronic pain, and he put needles into motor points as well. So this is in there to kind of just give you the full explanation. But basically he was saying that a denervated organ, like the muscle, will become hyperexcitable. So like if you stop sending enough signal to the motor points, the muscle wants to hear the signal and will amp up. It will become hyperexcitable. And a lot of acetylcholine has to go out into the tissue to get it to fire, so that irritates the muscle, becomes hyperexcitable. So that can cause muscle shortening, muscle tightening, spasms, things like that, that we see when somebody does have a spinal issue. Usually it's bilateral when it's spinal. So in this, I liked his explanation because he published the Gunn approach to treating chronic pain. So in this interview, someone said, can you describe for a layman your approach to the study of treatment of pain? And he said, the conventional wisdom has always been that pain is the body's signal pointing to a physical injury or inflammation, which is how we treat pain still, right? Take an anti-inflammatory. That can be true, of course, but most pain is different. Doctors have been mystified by pain, which is not related to any obvious injury. Because of this misunderstanding, for centuries, much treatment of pain has failed because doctors have tried to find the root causes in injuries that are just not there. Most chronic, persistent pain arises not from injury, but from subtle dysfunctions in the nervous system. I call it neuropathic pain. Almost invariably, nerves to muscles are involved. Affected muscles become shortened, and this physically compounds pain. So you need to know that that's how the muscles respond to pain. They shorten in most cases. Can you, in fact, cure pain? Yes, certainly. It's a joy that patients are so grateful. Of course, in reality, we treat the underlying pathology. If you can find the shortened muscles where the pain is located and relax them, the pain will cease. I have developed a technique called intramuscular stimulation to stimulate the nerves within the muscles. That's the motor point. He's making it really basic for this person, but he was using the motor point. I've developed, X-rays and MRI are no help in diagnosis and assessment because a contracted muscle looks the same as a healthy one. You see this all the time once you're doing motor points and you get people coming in with MRIs that say they can't find anything wrong. with my hip, but I'm still in hip pain. With training and skill, you can feel whether a muscle is tight or not. I have also found that neuropathic pain has its own specific signs, and one can tell objectively when the pain is relieved. To stimulate the nerves in the muscle, I use a very thin acupuncture needle. You can actually feel the affected muscle cramp onto the needle, and then it relaxes, and you've tapped the source of the pain. There are no drugs and no expensive equipment, so the treatment is very accessible and affordable, which is probably why no one knows about it. If you could make it more expensive and profitable, everybody would already know about using motor points to release muscles.